Dear colleagues, my name is Anna Kushnir. I am a pediatrician in the International Clinic of Rehabilitation that is situated in Truskavets, Ukraine. Today I'm going to tell you about our last study, hand function in children with cerebral palsy undergoing intensive neurophysiological rehabilitation. Limited hand function is a common developmental impairment in children with cerebral palsy and a strong predictor of a child's restricted ability to participate in daily activities. Growing evidence suggests that intensive, high-dose, repetitive, goal-oriented, activity-based functional approaches are effective in improving hand function of children with cerebral palsy. One of those approaches is Intensive Neurophysiological Rehabilitation System, or INRS. It is a novel intensive approach that combines several active and passive rehabilitative components to improve functioning and quality of life of children with cerebral palsy. It lasts 2 weeks, up to 55 hours in total, and it is tailored individually based on age, motor abilities, and functional goals. It includes fine and gross motor activities with gradually increasing complexity. Also, it consists of elements of play because, of course, motivation matters. On this slide, you can see the components of INRS. Physical therapy, occupational therapy, joint mobilization, gait training, spinal manipulative therapy, strength training, computer game therapy, and other modalities. In 2018, a retrospective analysis of the results of treatment with INRS was conducted. 9,462 cases were analyzed, and based on reports by parents and medical doctors, fine motor skills improved in 32% of cases. These findings could help to formulate a new aim to assess changes in hand function in children with bilateral spastic forms of cerebral palsy after the 2-week treatment with intensive neurophysiological rehabilitation system in a new prospective case series study. Study design. After initial patient assessment and checking for inclusion and exclusion criteria, all participants were assessed according to outcome measures. After that, all of them received therapeutic intervention, INRS treatment course that lasted 4 hours per day, 11 days per 2 weeks. In the end of the course, all participants received post-intervention assessment. Inclusion criteria were spastic forms of cerebral palsy, bilateral impairment, age 6 to 15 years, and level 1 to 3 according to MAX. Exclusion criteria were moderate to severe cognitive deficit, uncooperative behavior, contractures of upper extremity joints, and previous hand surgery. So participants in this study were 32 children with spastic bilateral cerebral palsy. Mean age was 10.2 years, and the prevalent diagnosis was cerebral palsy, spastic quadriplegia in 65.6%. Prevailed level according to MAX were level 2 and level 3. We selected outcome measures, took into account ICF framework and different aspects of hand function, grip strength, manual dexterity, and manual ability. Primary outcome measure was Jepson-Taylor hand function test. It is a reliable and responsive tool for tracking short-term changes in children with cerebral palsy. It measures the time to complete manual tasks that resemble common activities of daily living. But we excluded one task, writing a simple sentence, due to the age of our participants. Secondary outcome measures. Able-hand Kids Questionnaire was created to assess the manual ability of children with cerebral palsy. And in our study, we used the Ukrainian version that has been adapted and validated for the Ukrainian population. Also, secondary outcome measures were box and blocks test to evaluate the manual dexterity and hand dynamometry to assess the grip strength. Results. Let me start from the primary outcome measure from results of Jepsen-Taylor hand function test for the dominant hand. Total score increased statistically significant in 14.9 seconds. And also we observed statistically significant changes in 3 subtests. Spooning 5 kidney beans into a bowl, moving large light objects, and moving large weighted objects. Changes that were observed in these subtests require gross manipulation rather than fine motor skills. And these findings are in line in the research of other authors that stated that minimum duration of treatment that demonstrated improvement of fine motor coordination is at least 5 weeks. And in our case, it's only 2 weeks. Now, results of Jepsen-Taylor hand function test for non-dominant hand. Changes were not statistically significant, but there was a statistically significant result in 1.2 seconds for the subtest moving large light objects. It's an interesting tendency, with asymmetric improvements for better improvement for dominant hand, because other authors reported the same after the intensive treatment on the similar population. Results of box and blocks test were statistically significant for both dominant and non-dominant hand. Results of able-hand Kids Questionnaire didn't achieve statistical significance. Similar results were for hand dynamometry. Results for both dominant and non-dominant hand didn't achieve statistical significance. Conclusions. We observed statistically significant positive changes in dexterity of both hands and unimanual performance with the dominant hand in children with bilateral spastic cerebral palsy following the 2-week INRS course. Confirmatory studies, particularly randomized control trials, are needed for further investigation of this novel treatment program. Thank you for your attention. And on this slide, you can see the tree that was created by the little patients of our clinic. So thank you. Dziękuję bardzo.